Bismillahirrahmanirrahim. The quote of the day is, knowledge is not what is memorized, knowledge is what benefits. Assalamu alaikum. My name is Dr. Nabila Umar. I am working as PGR in Community Medicine Public Health, King Edward Medical University, Lahore. Today, my topic of the presentation is conflict management and how to improve ethical behavior in an organization under the kind supervision of Professor Dr. Saida Afzal. The learning objectives of the presentations are introduction, understand the nature of conflict, levels and types of conflict, the sources of conflict, conflict management, different resolution strategies, different resolution models, communication skills, how to improve ethical behavior, recent updates, and at the end, multiple choice questions. Learning outcomes. At the end of the presentation, you will be able to understand the dynamics of conflict. You'll be able to get yourself familiar with conflict resolution styles, how to improve conflict management skills, and to implement the conflict management frameworks. What is a conflict? An interactive process manifested in incompatibility, disagreement, or dissonance within or between social entities is known as conflict. Either it is between individuals, group, or an organization. Organizational conflict. It occurs when members engage in activities that are incompatible with those of colleagues within the network, members of other collectivities, or unaffiliated individuals who utilize the services or products of the organization. What is the difference between a conflict and a disagreement? Disagreements are open. Everyone involved knows what person thinks. They are sometimes called arguments. They may end up in agreement. Whereas in conflict, people often make assumptions about the other person or people's view. There is often little desire to communicate openly. Conflict is usually the result of misunderstanding between the parties involved. The thing to remember is, conflict is not always bad. Conflict can be very healthy. It increases awareness of the problems that exist and provides a reason for finding a better way forward. Different perspectives of conflict. Number one is traditional view. According to this view, conflict is seen as negative and something to be avoided. This view emphasizes suppressing emotions and maintaining harmony. According to this belief, all conflict is harmful and must be avoided. Human relations view. This view allows accepting conflict and sees it as beneficial to the organization in general. This view does not see conflict as a negative and destructive component of an organization. The third perspective is interactionist view of conflict. This view believes that conflict is not only a positive force in a group, but it is absolutely necessary for a group to perform effectively. Sources of conflict in healthcare. Resource scarcity. Limited resources like beds, equipment, or staff can lead to competition and conflict. Differing values. Disagreements about ethical principles, patient care approaches, or organizational priorities can cause conflict. Miscommunication. Incomplete or unclear communication can lead to misunderstandings and conflict. Personality clashes. Incompatible personalities or communication styles can create tension and conflict. What are the levels and types of conflict? By level of conflict, we are referring to the number of individuals involved in the conflict. There are 4 levels which can be identified: intrapersonal conflict, interpersonal conflict, intergroup, and interorganizational conflict. Intrapersonal conflict. Intrapersonal conflict arises within a person. In the workplace, this is often the result of competing motivations or roles. For example, perhaps you have been given the task of finding a trainer for a company's business writing training program. You may feel unsure about what kind of person to hire, a well-known but expensive trainer or a local unknown but low-priced trainer. If you haven't been given guidelines about what's expected, you may be wrestling with several options. Another example related to healthcare setting is, for example, a nurse having a conflicting feelings when asked to work an extra shift. Interpersonal conflict. Interpersonal conflict is among individuals such as co-workers, a manager and an employee, or CEOs and their staff. Many companies suffer because of interpersonal conflicts as it results in loss of productivity and employee turnover. Interpersonal conflict may erupt between a healthcare worker and an unlicensed assistive personnel over uncompleted tasks or miscommunication. Intergroup conflict. Intergroup conflict is conflict that takes place among different groups and often involves disagreements over goals, values, or resources. Types of groups may include different departments, employee unit, unions, or management in a company, or competing companies that supply the same customers. An intergroup conflict may occur between the nurses and pharmacy department regarding the timelines of medication delivery. Interorganizational conflict. Finally, we can see inter-organizational conflict in disputes between two companies in the same industry. For example, conflicts arising between nurses and emergency department of the same hospital. Now, what are the types of conflicts? Relationship conflict. It stems from interpersonal differences and incompatibilities. Process conflict. It refers to disagreement over the group's approach to the task and its methods. Task conflict. It relates to the differences in viewpoint and opinion about a particular goal or task. Cognitive conflict. It can result when one person or group holds ideas or opinions that are inconsistent with those of others. Now, what is conflict management and how we can manage different conflicts? Conflict management is a comprehensive term indicating the range of attitudes and behaviors that individuals, groups, and organizations manifest in dealing with conflict. There are different resolution strategies on how to manage a conflict. It can be competing, collaborating, compromise, avoiding, and accommodating. Number one is avoiding. This method involves simply ignoring that there may be a conflict. People tend to avoid conflict when they don't want to engage in it. Avoiding allows them to ignore that there is a problem. There are situations when avoiding conflict can be an appropriate response. When conflict is avoided, nothing is resolved. Number two is competing. Competing is an uncooperative, overly assertive method used by people who insist on winning the dispute at all cost. It is known as a win-lose strategy. This method is not often identified as bringing satisfactory resolution as it doesn't allow for collaborative problem solving. Number three is accommodating. This strategy, also known as smoothing, involves one party giving the opposing party exactly what it needs to resolve the problem. This method allows you to resolve a problem in the short term while working toward a long-term solution. In some cases, accommodating can be an appropriate resolution to a conflict. For example, if your opinion on the matter is not very strong, it is often easier to comply. Number four is collaborating. Like the compromising method, collaboration involves working with the other party to find a mutually agreeable solution to a problem. It is known as a win-win strategy. For example, a salesperson and a client may work together to negotiate contract terms until both parties find it agreeable. Number five is compromising. This strategy, also known as reconciling, seeks a mutual agreement to settle a dispute. It's known as a lose-lose strategy since both parties willingly forfeit some of their needs in the interest of reaching an agreement. This can be a quick way to resolve a conflict without it becoming a bigger issue. Conflict resolution models. Conflict is inevitable in any workplace, but it can also be damaging if not handled properly. Whether it's a disagreement over a project, a clash of personalities, or a misunderstanding of expectations, conflict can affect productivity, morale, and teamwork. That is why it is important to have some models and frameworks to help resolve conflicts in the workplace effectively and constructively. Following common models and frameworks that can help understand the causes, stages, and outcomes of conflict. The Thomas Kilmann model, the interest-based relational approach, the circle of conflict, and the conflict resolution process. The first one is the Thomas Kilmann model. It is one of the most widely used frameworks for conflict resolution. It identifies 5 styles of handling conflict based on 2 dimensions, assertiveness and cooperativeness. The 5 styles are competing, collaborating, compromising, avoiding, and accommodating, as it is explained in the previous slides. Each style has its own advantages and disadvantages, depending on the situation and the relationship. The model helps to assess your own preferred style as well as the style of the other party and choose the most appropriate one for the conflict at hand. The second approach is the interest-based interrelational approach. It is a framework that focuses on finding a win-win solution for both the parties in a conflict. It emphasizes the importance of maintaining a positive relationship, respecting each other's interests and needs, and communicating openly and honestly. The approach involves 4 steps: separating the people from the problem, focusing on interests rather than positions, generating creative options, using objective criteria to evaluate solutions. This approach helps to avoid getting stuck in positional bargaining, where each party tries to defend their own positions and make concessions and instead look for a mutually beneficial outcome. There are certain steps for this approach. Step number 1 is explain each point of view. Step number 2 is agree on where the conflict lies. Step number 3 is brainstorm possible resolution to the conflict and at the end negotiate a resolution. The third framework is the circle of conflict. The circle of conflict is a model that'll help you analyze the resources of conflict and identify the best strategies to address them. It categorizes the causes of conflict into 6 types: data conflicts, relationship conflicts, interest conflicts, structure conflicts, value conflicts, and style conflicts. Each type of conflict has its own characteristic, challenges, and solutions. The model helps you diagnose the root cause of the conflict and tailor your response accordingly. The last model is the conflict resolution process. The conflict resolution process is a framework that guides you through the steps of resolving a conflict in a systematic and effective way. It consists of 6 stages: preparing for resolution, creating a safe space, listening actively, exploring the situation, building solutions, following up. Each stage has its own objectives, techniques, and challenges. The framework helps you structure your conversation and follows a clear plan to reach a resolution. Now, what are certain communication skills for conflict management? Active listening, paying attention to the speaker's words and emotions and responding in a way that shows understanding. Assertive communication, expressing your needs and opinions clearly and directly while respecting the other person's perspective. Non-verbal communication, understanding and managing body language, tone of voice, and facial expressions to convey respect and empathy. Conflict resolution techniques, employing techniques such as compromise, negotiation, and mediation to find mutually acceptable solutions. Empathy and respect. This means trying to understand the other person's feelings, needs, and values, and acknowledging them without judging or dismissing them. Negotiate and compromise. This means finding a middle ground or mutually acceptable solution that meets the needs and interests of both parties. Negotiation techniques in healthcare. Collaborative negotiation focuses on finding solutions that meet the needs of both parties. Competitive negotiation, it aims to win at the expense of the other party. Distributive negotiation involves dividing a fixed resource such as budget or time. Integrative negotiation, it expands the pie by creating new options and solutions. Mediation and facilitation in healthcare. Step number 1, define the issue. Identify the specific issue in a conflict. Step number 2, explore perspective, encouraging both parties to share their viewpoints and needs. Step number 3, generate options. Brainstorm potential solutions that address the needs of both parties. And step number 4, agreement and implementation. Facilitate the negotiation of a mutually acceptable agreement. The other part of the topic is how to improve ethical behavior in an organization. There are certain steps. Number 1 is establish a clear ethical framework. Develop and implement a comprehensive code of ethics. Create and enforce policies that address common ethical issues. Lead by example. Ensure that top executives and leaders model ethical behavior. Leaders should frequently communicate the importance of ethical behavior. Number 3, foster an ethical culture. Provide regular ethics training and workshops for employees at all levels. Encourage open dialogue about ethical issues and create a culture where employees feel comfortable reporting unethical behavior. Number 4 is implement effective reporting mechanisms. Establish confidential and secure channels for employees to report unethical behavior. Regularly solicit feedback from employees about ethical practices and potential improvements. Now, there are certain updates and research articles related to the conflict management. This is a research article which is published in 2016, Climate for Conflict Management, Exposure to Workplace Bullying and Work Engagement, a moderated mediation analysis. This study investigates a potential preventive factor in relation to workplace bullying. Specifically, we examine how climate for conflict management may be related to less bullying, increased work engagement, as well as whether the climate for conflict management is a moderator in the bullying engagement relationship. The study was based on a cross-sectional survey among employees in a transport company. Hypotheses were tested simultaneously in a moderated mediation analysis, which showed that bullying and job engagement were related. The climate for conflict management were related to less reports of bullying. This management was related to work engagement, and that management was indirectly related to job engagement through bullying, but only when the conflict management was weak. That is, this management moderated the relationship between bullying and work engagement, in that this relationship only existed when conflict management was low. The present study contributes to theory within this research field by showing that organizational bias may not only prevent bullying, but may also affect how employees react when subject to bullying. Furthermore, the effect of climate in relation to bullying may be down to the narrow bandwidth facet of conflict management. The study informs employers how they may act to prevent bullying, while also reducing the potential negative outcomes of those cases of bullying that inevitably will show up from time to time. Another research, which was published in 2024 in the International Journal of Health System Implementation Research, Conflict Management in Healthcare Settings, an Essential Public Health Skill. The health system is one of the most human resource intensive organization. The scope, dimension of work in any health system and the interdependence of each compartment of the health system make it even more complex. The complexity of the health system coupled with the inadequacy, unequal distribution, and incompetency of the human resources makes it vulnerable to workplace conflicts, further plagues performance. The addition of new cadres of human resources to increase efficiency also create opportunities for new conflicts in the workplace. We enumerate conflict management skills, which are essential to be practiced by the health practitioners to identify and resolve conflicts early using appropriate methods. The health sector is highly human resource intensive and presents an amalgamation of various departments and cadres of workforce. Each carries out vital yet often interdependent roles. With such diversity in the workplace and activity under one roof, enough opportunities exist for conflict. There is a need to focus on conflict management as a technique to recognize potential conflicts early and deal with them effectively and promptly to avoid untoward occurrences and thereby increase the efficiency of health system. As a public health physician and manager, one should be equipped with skills in recognizing and addressing this type of conflict using proven strategies that can smooth day-to-day functioning and improve the overall organizational performance. Multiple choice questions. Number 1, during a strategic planning meeting, a non-profit organization encourages passionate debates and differing viewpoints among members, believing that such conflicts will lead to more innovative and effective strategies. Which perspective does this approach represent? A, traditional view, B, human relations view, C, interactionist view, D, consensus view, and E, functional view.
C.
Yes, the answer is C, interactionist view. Number 2, Aisha is a nursing manager working in a private hospital. She is considering whether to advocate for additional staff to reduce their own workload, which would improve their work-life balance, or to manage with the current staff levels to avoid possible conflicts with upper management. What type of conflict is Aisha experiencing? A, role conflict, B, intergroup conflict, C, organizational conflict, D, interpersonal conflict, E, intrapersonal conflict.
E.
Yes, the answer is E, intrapersonal conflict. Number 3, in a community health organization, there is conflict between outreach team and the research team regarding the focus of a new public health campaign. The outreach team wants to target immediate community needs, while the research team prefers a data-driven approach with long-term goals. What type of conflict is present in this scenario? A, interpersonal conflict, B, role conflict, C, intergroup conflict, D, intrapersonal conflict, or E, organizational conflict.
C. C.
Yes, the answer is B, intergroup conflict. A, number 4, Ali is a postgraduate resident working in Mayo Hospital, Lahore. Ali and an administrative staff member are in conflict over the handling of patient referrals. The medical professional believes the referrals are being processed too slowly, while the administrative staff member thinks the medical professional is not providing necessary information in a timely manner. What type of conflict is described in this situation? A, intrapersonal conflict, B, intergroup conflict, C, interorganizational conflict, D, interpersonal conflict, E, ethical conflict.
D. C.
The answer is D, interpersonal conflict. Number 5, 2 departments in a hospital needs to use the same room for different purposes at the same time. One department has a pressing need while the other has a routine appointment. If one department decides to give up their reservation to avoid confrontation and maintains a positive relationship, which conflict resolution strategy are they using? A, accommodating, B, compromising, C, competing, D, avoiding, E, collaborating.
E. B. B.
The answer is A, accommodating. Number 6, a pharmacist and a doctor argue over a medication error where the doctor feels the pharmacist should have caught the mistake and the pharmacist feels the prescription was unclear. If the doctor insists on taking the issue up with the hospital administration to ensure accountability and make a point, which conflict resolution strategy is being used? A, compromising, B, accommodating, C, collaborating, D, avoiding, E, competing.
E.
The answer is E, competing. Number 7. Sidra is working as a staff nurse in Jinnah Hospital, Lahore. In the same hospital, Usman, a technician, is also working. He disagrees with Sidra on how to handle patient information. The technician wants to use a more streamlined system that the nurse feels compromises privacy. If the two parties choose to work together to develop a new system that ensures privacy and improves efficiency, which strategy are they using? A, avoiding, B, competing, C, collaborating, D, accommodating, E, compromising.
C. E.
C.
The answer is C, collaborating. Number 8. A nurse and a doctor disagree on the preferred treatment approach for a patient with a rare condition. The nurse believes in a less aggressive method, while the doctor advocates for a more aggressive treatment. If the two parties work together to review research, consult with specialists, and create a unified treatment plan, which conflict resolution model are they applying? Number A, the circle of conflict. B, interest-based relational approach. C, conflict resolution process. D, Thomas Kilmann model. E, avoiding conflict model.
B.
B.
The answer is B, interest-based relational approach. Number 9. During a team meeting, a team member provides feedback on a project, but the feedback is misunderstood by another member, leading to tension. If the team member who received the feedback actively listens to understand both the content and the emotions behind the feedback, what communication skill are they using? A, non-verbal communication. B, assertive communication. C, empathy and respect. D, negotiation. E, active listening.
E.
D.
The answer is
A.
E. Answer is E, active listening. Number 10. A private organization is working in Lahore. It reviews the ethical policies and practices regularly and make necessary adjustment based on employee feedback and reported issues. What practice is being applied to ensure the effectiveness of ethical behavior improvement strategies? A, lead by example. B, foster an ethical culture. C, establish a clear ethical framework. D, implement effective reporting mechanism. E, communicative effectively.
D.
The answer is D, implement effective reporting mechanisms. This is the key to the MCQs. This is the YouTube channel where the video will be uploaded. Thank you.
Thank you very much, Dr. Nabila. This is a very nice presentation, and there is a lot of hard work there that you have put in order to make this presentation. However, I have a bit of advice for you that you must review more literature and see the recent advances, because I have seen that the references, they are not very recent, and they are deficient in your presentation. So more review of literature is required. Otherwise, it is a very good presentation and nicely done. Thank you.
Thank you, ma'am.